Hey there, my friend, yes, you. Have you ever wondered why some days your back feels like it's screaming at you, while other days it's just a dull whisper? And here's the million-dollar question: when that pain hits, should you grab an ice pack or a heating pad? Stick with me, because today, I'm spilling the tea, medically backed tea, on heat versus cold therapy for back pain. I'm Dr. Anna Schneider, your back pain warrior with over 15 years of experience helping people just like you take back control of their bodies. And trust me, by the end of this, you're going to feel empowered, proud, and ready to tackle that ache head-on. Let's dive in. Picture this: it's March 23rd, 2025, and I just finished a day at the clinic. One patient, Sarah, a 38-year-old mom, came in clutching her lower back after lifting her toddler. She was frustrated, exhausted, and said, "Dr. Anna, I've tried ice, I've tried heat, nothing works." Sound familiar? Maybe you've been there too, caught in that guessing game of what's best for your back. Well, today's story isn't just about Sarah, it's about you. We're breaking down the science of heat and cold therapy, busting myths, and giving you the tools to own your recovery. Ready to feel like the hero of your own health story? Let's go. Alright, let's get nerdy for a sec, because knowledge is power, and I want you to feel powerful. Back pain can come from a million places: muscle strain, inflammation, arthritis, or even that sneaky stress you're carrying around. But here's the kicker: heat and cold work in totally different ways to fight that pain. Think of them as your dynamic duo, Batman and Robin for your spine. Cold therapy, the inflammation slayer. First up, cold therapy. Imagine you just tweaked your back lifting something heavy, like Sarah with her toddler. Your muscles are inflamed, swollen, and angry. Cold steps in like a superhero with an ice cape. It constricts your blood vessels, slows down blood flow, and numbs those screaming nerve endings. Studies, like one from the Journal of Athletic Training, show cold can reduce inflammation by up to 20% in acute injuries. That's huge. Here's the real talk: about 80% of adults will deal with back pain at some point. Yep, 8 out of 10 of us. And for those fresh injuries, say, within the first 48 hours, cold is your go-to. It's like hitting the pause button on that pain cycle. But don't just take my word for it. What's your go-to when you feel that sharp sting? Drop it in the comments, I'm dying to hear. Heat therapy, the muscle whisperer. Now, let's flip the script to heat. Picture this: you've had a long day, your back's stiff, and it feels like your muscles are in a permanent knot. Heat is your warm hug. It dilates blood vessels, boosts circulation, and relaxes those tight fibers. Research from the Spine Journal found that heat can improve muscle flexibility by 10–15%. That's why it's gold for chronic pain or stiffness. I see this all the time in my clinic: patients with lingering aches, like from sitting at a desk too long, come alive after heat. It's like giving your muscles permission to let go. So, quick poll: do you sit more than 6 hours a day? Raise your hand in spirit and let me know in the comments, because heat might just be your new best friend. Okay, here's where it gets fun. I'm holding the tools of the trade, ice in one hand, heat in the other. So, how do you know which one to pick? Let's break it down like we're strategizing a winning game plan, because you deserve to win at this. Cold therapy wins when you've got a fresh injury, think sprains, strains, or that "oops, I overdid it" moment. Use it for 15 to 20 minutes every couple of hours in those first 48 hours. Pro tip: wrap that ice pack in a towel, your skin will thank you. Swelling or redness is showing up. Cold your inflammation bouncer, kicking it to the curb. The pain's sharp and sudden. It's like a fire alarm, cold turns down the volume. Real story: Sarah, my patient today, had that acute flare-up. We started with cold, and within a day, she was moving better. That's the power of listening to your body. Heat therapy shines when your pain's chronic, like that nagging ache you've had for weeks. Heat loosens things up, 20 to 30 minutes at a time. Stiffness is your enemy. Maybe you woke up feeling like the Tin Man. Heat your oil can. Stress is sneaking in. Heat doesn't just relax muscles, it calms your mind too. I had a patient, Mark, a 45-year-old teacher, who swore by his heating pad after grading papers all day. He told me, "Dr. Anna, it's like a reset button." What's your reset button? Share it below, I'm all ears. Can you use both? Heck yes. Here's a pro move, alternate them. Start with cold for a new injury, then switch to heat after a couple days when the swelling's down. It's like a 1-2 punch to knock out pain. Studies, like one from Physical Therapy Reviews, back this up. Combining therapies can speed recovery by 25%. You're not just surviving, you're thriving. Let's clear the air, because I know you've heard some wild stuff out there. Myth number 1, cold is always better than heat. Nope. It's about timing, acute versus chronic. Myth 2, heat makes inflammation worse. Not true if you're past that initial swelling phase. And myth 3, you can't overdo it. Oh yes, you can. Too much ice or heat can irritate your skin or nerves. Stick to 20-minute sessions, and you're golden. Got a back pain myth you've heard? Drop it in the comments, let's bust it together. Let's talk facts, because you're worth it. The World Health Organization says back pain is the leading cause of disability worldwide, affecting over 600 million people. That's more than the population of the US and Canada combined. And here's the kicker, 90% of cases are nonspecific, meaning no clear injury, just wear and tear or lifestyle. But here's the hope, a 2022 study in pain medicine found that 70% of people using heat or cold therapy consistently saw improvement within a month. That's you in the driver's seat. You're not a statistic, you're a fighter. So, what's your biggest back pain struggle? Tell me below, I'm here for it. Alright, my friend, let's wrap this up with some gold nuggets from my 15 years in the trenches. First, test it out, your body's unique, so see what feels right. Second, don't skip the basics, stretch, move, hydrate, heat and cold are teammates, not the whole team. Third, listen to your pain. Sharp and new? Cold? Dull and stubborn? Heat? And fourth, be consistent, 10 to 20 minutes a day can change the game. Oh, and one more thing, safety first. No falling asleep with a heating pad, okay? I've seen too many close calls. You're too awesome for that. Here's the truth, your back pain doesn't own you, you own it. You've got the knowledge now, the power to choose heat or cold like a pro. I'm so proud of you for showing up today, for fighting for your health. You're not just surviving, you're rewriting your story. So, let's keep this going. Drop a comment, what's your go-to, heat or cold? Where are you watching from, New York, Tokyo, Sydney? I want to know. And if this helped you, smash that like button, it tells me to keep bringing you the good stuff. Share this with someone who needs it, because we're in this together. I'm Dr. Anna Schneider, your back pain buddy, and I'll see you in the next one. Keep shining, you've got this.